All right, and then we move into flossing. Let's talk about what to look for in a good floss and what we want to avoid.
Yeah, unfortunately, the floss industry is pretty toxic. Even some of the cleaner flosses, I know this because I've created a floss myself. It hasn't launched. I have the IP for it, but I know a lot about floss that I never thought I would. But it's a lot of floss is petroleum based, lots of PFAS, microplastics. They're coated with artificial flavorings and fluoride and things of this nature too. And so, especially with our concerns with microplastic and forever chemicals, we need to be mindful of this. And again, even some of the cleaner flosses, the way they market, there's a lot of greenwashing out there. And so, a lot of the woven flosses, which I love the way it cleans and feels, but they tend to not be as clean as you think because something has to be creating that stretchiness. It's usually some sort of petroleum based polyester or something. And it will say PFAS free, but there's something else in that. It's just like when you say BPA free, but BPA is just one type of plasticizer, right? So my favorite floss that I find to be the cleanest and the best for the environment is silk or bamboo. And so you can just get spools of that. There's no particular brand I like. I would just say find one that doesn't have a lot of coatings or flavorings. And then, with kids, it's really hard because the floss sticks really are the easiest. And this is what I created was a floss stick that's completely compostable that has, it uses silk. And we could do bamboo too. But they're just not out to market yet. I'm still working on that. So they do make restringable. They're usually plastic or metal flossers that you like with tines that you can kind of restring. I find that hard because it's like one more step for families to do and they're already maybe not the most stellar flossers. If you're really concerned, you can start water picking. And because that's just a blast of water between your teeth, and that can be very beneficial. And the studies actually show it's quite comparable to regular flossing. But I would say for your typical string floss, I would really look for silk or bamboo because it's just the cleanest and also the best for our environment because most floss, it won't biodegrade. So it's just sticking around in landfills.
Your colleague and business partner, Dr. Berhenna, is a big fan of the slate flosser. Have you heard of this or tried it?
Yes. Oh, no, I love it too. The slate flosser is great. Yes. Yeah, everyone should check it out. So just like we like electric toothbrushes, we love electric flossers. And I was a little hesitant at first because I'm not a super gadget person, or at least I don't think I am. But then I started using it and it really does get a lot out of there. So everyone check that out, especially if you find it's just hard to get yourself to floss. It takes a lot of the work out of it and it makes it fun. And especially with kids, like kids really like slate flosser too. Anything that makes oral hygiene a little more exciting, I'm all for because I get it. It's, I can say that this is what we need to be doing. And at the end of the night, when you're exhausted and you've had a hard day, it's really hard to spend those few minutes in the bathroom taking care of your teeth. I fully understand that. So anything that can spice it up a little bit. Some strategies I have too to get oral hygiene done is try it in the shower. Like get a suction mirror, stick it in there, leave everything in the shower. And so you can use your slate flosser or your floss, your water pick. They make cordless water picks that I love to bring in the bath or the shower, especially with kids because they'll use it like a water gun. So do it in the bathtub. And those water picks can be really beneficial to patients with sensory issues too. They don't love the feeling of floss or their hands in their mouth, but they tend to do okay with water picks. But yeah, leave your toothbrush, everything in the shower. Just streamline everything. It doesn't have to be standing in front of the bathroom mirror like we think it has to be. With my kids, when they were really young, I did a lot of oral hygiene routine on their changing table. And I did a lot in the bedroom while we were reading books together. We never have used fluoride toothpaste, so I never was worried about them spitting per se. So we would just do a lot of it. Whatever works is what I say is what I want you to do. And that also might mean I just can't get my routine done in the morning. but I'm pretty good at night. That's okay. Like, I will accept that. Or maybe it's the opposite. Like, nights are too hard. I'm exhausted. Then really just try to focus on a great morning routine or a midday routine. Like, I really want it to be achievable, and we need to be adaptable for patient circumstances, knowing that everybody kind of has a different life out there. But at least once a day, I'd love people to try to spend a few minutes on their teeth.
What do you use for a toothbrush? Are you a fan of electric, manual?
I use a Sonicare. I've used a Sonicare since I was 20. So it's been a lot, almost 3 decades. The data is pretty strong with Sonicare. Oral-B is another one. I personally find Oral-B to be too stimulating and too bumpy for me. You do you, everyone do you, but Sonicare is my favorite. I think the best brushing is manual. However, it would take an extreme amount of focus and discipline that I think most of us don't have, including myself. So it just takes away some of the work and the thought. And the data is pretty powerful of what it can do to remove that sticky, unideal biofilm from our teeth.
And what should we look for with bristles? They have different, soft, medium, more hard, and they have different contours.
Yes, I like soft, and you want a more rounded, and like some of them you can look under microscopes and they have really sharp corners, and those can be obviously abrasive, those sharp corners. So a more tufted or rounded end. It won't market it that way, unfortunately, but most companies are thoughtful and mindful with that, I think. But I do like softer bristles. There's a little controversy with that. Some dentists, even functional dentists, prefer, I've seen them say more hard or medium. And I get why they say that. But again, to use that properly and not damage your gums or enamel, you'd have to be so hyper focused on exactly how you're holding it and moving it. And I think most people don't have that skill set or patience, including myself. So I do like the softer brush. Just to preserve your enamel so you're not wearing away your enamel by aggressively brushing. And that's the other thing. I think people think they really have to scrub so hard and put so much force and effort into it. I suggest patients think more like a paintbrush stroke. Like, how would you hold a paintbrush? That's how lightly you really want to be brushing your teeth. The other thing I will say, if you tend to eat a more paleo diet, you're not going to have a thick, sticky biofilm or plaque like patients who eat a lot of carbs and breads and crackers and cereals and things. So you won't feel like you need to scrub your teeth as much. And that is a diet that I do generally suggest, like more Mediterranean or paleo, just for systemic health too. But patients who tend to eat that way, they do tend to have healthier mouths as well. It's funny how, it's all connected. So what's good for the body is good for the mouth too.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Something that quite literally keeps me up at night, I'm very worried about it. I think it's a global epidemic. Not many are speaking about it. It's something called enamel hypoplasia, or it's basically undermineralized enamel.